number of measles cases across the nation just keeps going up, with at least 122 confirmed cases in 18 different states. So far, Massachusetts has not seen any, but experts say there is a risk. The whole issue surrounding vaccinations and the fear many people have of them is the subject of a Nova documentary called Vaccines, Calling the Shots. Here's a clip.
I'm kind of debating whether I will do them, but I'm debating the age. When should I have them done?
There's just so much information there, and I don't know who to ask. There's no such thing as an unbiased source.
As a result of health concerns, approximately 10% of parents either delay or skip some shots, and around 1% don't vaccinate at all. In some places, those rates are far higher. My guests tonight have done a great deal of research on vaccines and their safety and benefits. Joining me now are Dr. Rick Malley, an infectious disease specialist at Boston Children's Hospital, and Barry Bloom, a scientist and professor at Harvard School of Public Health. Thank you both for being here. Dr. Malley, let me start by asking you, how many kids have you seen in a clinical setting lately who have not been vaccinated, and what sort of ailments are they suffering from as a result?
Well, the good news in Massachusetts is that the number of children who actually are not vaccinated is quite low. Our state is really among the highest states in terms of rates of vaccination. And so while I think it's completely reasonable to worry that you might have the introduction of measles cases from unvaccinated individuals who acquire measles and come to Massachusetts, actually the risk in Massachusetts children is low because most of our kids are in fact vaccinated.
So approximately how many are not vaccinated here in Massachusetts?
I think it depends on different areas of Massachusetts. So you have some areas where you have little pockets of children that are not vaccinated, but in general we're really talking a small percentage of kids that are not fully vaccinated, and in some instances it's delayed vaccination rather than total refusal to vaccinate, for example.
Dr. Bloom, give us a sense of how the Massachusetts status quo that Dr. Malley just described compares to what we see around the country. We saw some broad brush numbers there in the introductory piece, but are there parts of the country where a worrisomely large percentage of kids are not vaccinated? If so, where is that happening, and who's behind it?
The good news is that overall nationwide, the estimates are about 92% of all children that should be vaccinated get some vaccines, not necessarily all of them. There are states that do better than others, and Mississippi, believe it or not, and West Virginia are two of the top, making sure that their kids get the highest rates of coverage in the country. But taking it by states isn't sufficient because there are communities of people that are at high risk. There was a school described in Los Angeles where 68% of the kids had no vaccines at all. There are really two sets of reasons. One, people are really poor and don't know that the federal government has a children's vaccine program that could cover that, and that is responsible for part of it, and a lot of it is parental choice.
I want to ask you about that question about poverty, because my sense has been, and I haven't been following this closely at all, I'm just a layperson, reading and watching the news, but my sense is that perhaps in addition to impoverished people who might not be aware of programs that are out there that will let their kids get these vaccines, that there's also something of a vogue right now, if that's the right use of the term, among well-educated, affluent people who are perhaps skeptical of things like genetically modified organisms and view this in the same way they view those, or afraid that harm is going to come to their children inadvertently. So how much is impoverished people and how much is affluent, well-educated people?
I don't think anybody really knows.
Okay.
And the reason is there are many different reasons that parents choose not to vaccinate their children. Some are worried about toxins, some prefer things to be natural, and vaccines are not as natural as getting sick as you could from the real disease. Some of it is opposition and skepticism about science. Some of it is distrust of government, distrust of industry. So there's a whole litany of reasons, and we don't fully understand how they came about, how parents get their information and make those decisions.
What do you get from any parents you might come across who say, actually, doctor, I'm choosing not to vaccinate my child or my children? What do you hear?
Well, one very strong example in the case of the measles, mumps, rubella vaccine has been the completely false allegation that the MMR vaccine is associated with autism. So we've heard this for many years now. The science, and I don't think we can use the word science on which those statements were based, is completely false. It was rejected by the same journal that published it in some years ago, the Lancet article by Wakefield. And unfortunately, the impact of that study has, that really falsified study, has been that there's been an association created in the minds of young parents and educated, as well as wealthy parents, for example, who have come to believe that this association was true, and that the reason for the fact that we are not currently worrying about autism and MMR is because there's some conspiracy, for example, among the medical establishment to try to hide the facts. And unfortunately for MMR, for the measles vaccine, even though this study has been debunked, that many of our patients come to us and suggest that even though they're not exactly sure, that association might be true, and therefore they would either like to delay the vaccine or forego it altogether. I
want to ask both of you about why there's that abiding suspicion about vaccines, despite the fact that the research has been debunked. But first, Dr. Bloom, I'm hoping you can explain the concept of herd immunity to those of us who lack medical acumen or expertise, because I know that's sort of at the core of what we're talking about here. What is herd immunity, and what do maybe members of the general public not understand about it?
Almost everybody is concerned about how to protect their child. We in the business of public health are trying to protect communities. So if you look at the chart, the red arrows indicate that when you introduce one kid with measles, you have red arrows that transmit to people who have not been vaccinated. If you vaccinate enough kids, then they bump into a kid or another kid that's already immune. And so it stops. You thereby protect the whole community by protecting a small number of kids.
But it's not necessarily the case, if I read that chart correctly, that the virus or a virus cannot be transmitted to someone who's been vaccinated. Sometimes the vaccine doesn't work, but there's a broader a wider chance of stopping it, right? A wider safety net cast. Am I interpreting that correctly? I know my terms are horribly inaccurate. But.
So the vaccine works pretty well, and the degree of protection is determined by how rapidly the virus transmits. So we know that for measles, one infected kid has the capacity to infect 16 other kids who will then transmit infection. So you need a very high rate of vaccine protection to have that virus bump into only kids who've been vaccinated. Others, like flu, only spread to 3 people. We don't quite need that high degree of coverage to get the whole community protected. But we believe it is a service not only to a child, your child, but to the whole community to see that your kids are vaccinated.
I want to come back to the abiding suspicion of vaccines and vaccine protocol that you mentioned earlier, Dr. Malley. Why do you think it is that so many people don't understand what they should understand and continue to be suspicious or fearful when they should not be?
Well, again, as Dr. Bloom said, I think it's a complicated situation. But one theme that I think is very important to remember is we're asking parents who are coming to us with a very healthy young baby to accept the view that we are going to inoculate them with something to protect that child against a disease that they've never heard of, that they have never seen.
In part because the vaccines have worked so well,
because the vaccines have been so successful. And so I think you may have heard that people are saying that vaccines are in fact the victim of their own success. Yeah. A very brief example I can give you is in 1990, when I started training in pediatrics, we were seeing children come down with meningitis at a rate of 1 in 200 kids. And from 1990 to 1991, the vaccine was introduced, the Haemophilus influenzae type B vaccine. And within 1 year, that vaccine was essentially eliminated from the pediatric population in Massachusetts and in the US in general. Now, when you talk to parents about this disease for which their kids are being vaccinated, they've never heard of it. And so the same thing is happening with measles. You're trying to propose to inject something into a child for a disease that
They've
nobody
never
here
had to
has
deal
seen.
with.
Right.
Briefly, I want to ask whichever one of you would like to weigh in, or both of you, is there anything the medical establishment could do differently that would make parents more inclined to get these vaccinations? We had a comment left on our website by a nurse who said basically the vaccine schedule is overwhelming. She suggested, for example, allowing parents to get their kids the measles vaccine independently from the mumps and rubella vaccine. Whether it's those changes or other changes, are there structural things that the medical establishment could do to help?
I think education is probably, and communication with patients is probably, and their parents is the most effective tool. In general, I think doctors, pediatricians, internists, nurses are reluctant to start trying to let parents or even groups of people cherry pick which vaccines and when they receive them, because ultimately you want to protect the child as soon as possible, and the schedule is crowded, but it's crowded for a very good reason. We want to protect children at the earliest possible stage when they're the most vulnerable. But I think the more you can talk to families about what the falsehoods are that they may read on the internet, that they may hear on from other friends who have heard it from somebody else, and really try to address their fears and explain to them what is known in science and what some of the fallacies may have been perpetuated, is really the best way to improve vaccination rates and reduce fear.
All right, Dr. Rick O'Malley, Dr. Barry Bloom, thank you both.